Good morning, everyone, or good afternoon, depending wherever you are. My name is Selina. I'm co-founder, CEO, as well as co-inventor of SOVN, and I've decided to do an AMA to share a little bit about the story behind SOVN, how the product was initially created, why we did it, and talk a little bit about the beta test that we will start in a few months and answer any question. So yeah, let's get started. Really looking forward to answer questions that either you've put in or you will put in shortly. So yeah, if you've read my welcome email, you know that I started grinding my teeth when I was 5, or at least that's what my sister and my parents told me. But it actually didn't really become an issue until I was in my 20s. That's when I first fractured my molar. I still remember when it happened, NBA Finals 2009. And I was eating a piece of chicken wing while watching the game with a group of friends, and I could hear the crunch and the shooting pain. And I remember feeling really, really panicked when I realized what had just happened. And ever since then, I've had all sorts of dental issues related to teeth grinding, spent a ton of money as a result of it, and just became really, really frustrated when I found that mouth guards and Botox seem to be the only two solutions that are recommended. Um, and yeah, so my dentist prescribed a mouth guard, which cost $800 out of pocket. I still remember thinking this has got to be the most expensive piece of plastic I've ever bought in my life. And for the first week after I bought the mouth guard, I was actually feeling quite excited about wearing it. Hey, I'm being an adult. I'm taking care of my health. This is what I need to do to protect my teeth because I want them to still be there when I'm older. But after a few weeks, I just couldn't stand it. It starts hurting my teeth, and then also, I notice all these marks on the mouth guard, all the fracture lines, which, funny enough, it made me realize how much damage I'm doing to my teeth. But at the same time, I also realized the mouth guard doesn't stop it. I'm still doing all of these things despite wearing it, and yeah, so I went through this cycle of wearing it for a few weeks, and then not wearing it because it was just so painful and it really disrupted my sleep. And then I would stop wearing it, and after a few weeks, I would try wearing it again out of guilt because I know I'm supposed to be wearing it. And I don't know if anyone else also feel this way, but I also felt fundamentally flawed for grinding my teeth. My dentist, as well as all the online articles I read at that time, seemed to suggest that, this is due to high stress and you need to learn how to distress, do meditation, yoga, and all sorts of things. At the same time, I didn't feel as if, my stress level is particularly high or higher than people around me. We live in a modern world. There's always some level of stress. It's not as if mine is exceptionally high. So I was wondering, like, why me in particular? What did I do wrong? Is it genetic? And why is mouth guard seemingly to be the only solution that's prescribed, even though it doesn't seem to do anything from a behavior perspective? So after a really, really bad night, uh, I just started becoming very obsessed with trying to find the answers to these questions. I was trained as an epidemiologist, and I just started digging into the research, interviewed experts, talked to other teeth grinders and clenchers, and basically found a few things that was quite baffling and interesting. The first one is that how common this was. I think 3 out of 10 adults do this. They had one study that showed in one night during a sleep study in the lab, that 60% of regular people, so these are people who have no bruxism symptoms whatsoever, also grind and clench their teeth. So it's a normal physiological behavior that all of us do. I think one of the research says that, yeah, 90% of people will grind or clench at some point in their lives. So it's extremely common. It's just that unfortunately for some of us we do it way more than others, and for some of us this causes way more health impact, whether it's to our teeth or to our jaw pain, neck pain, headaches, whatever it is. It seems to affect some people more than others. But at the same time, it's not an abnormal behavior. And scientists are still trying to figure out what is the cutoff at which it starts becoming detrimental to your health. We don't have a good answer for that either, because yeah, it's a pretty hard thing to research when you have to rely on polysomnography, a sleep lab study that costs thousands of dollars per night. And then the other thing that sort of clicked as I started researching into this is that if bruxism or teeth grinding and clenching truly is a normal physiological behavior that everyone does, then I realized where have all previous efforts to treat this condition has gone wrong. We're trying to solve this as if it's an acute disease to be cured. We keep on trying to find a magic bullet so that one day we won't grind anymore or we won't clench anymore. I think this is a futile attempt, because if this is indeed a behavior, which we can now establish as fact that it is, then you can't try to treat it with a magic bullet. You have to think of it as this is a behavior to be managed, and we have to find solutions that treat it as such. So that was just the eureka moment for me, and I'm lucky that I have a partner who is also part of this venture. And we basically said, okay, based on this findings, let's create a wearable that is comfortable, easy to use, really convenient for people, that can help people manage this subconscious behavior. Because ultimately, that's what bruxism is. It's an overlearned subconscious behavior. So why don't we come up with a device to help people manage it? And what we're thinking is it needs to curb the behavior real time. So let nudge you whenever you start doing it that, hey, it's time to stop. And then secondly, provide the user with data and insights to further elucidate the behavior, because a lot of things affect bruxism. A lot of things that you do during the day affect bruxism. A lot of things that you do about your sleep affect your bruxism as well. So we managed to recruit brilliant engineers, product designers, data scientists, and researchers, a lot of whom also happen to have teeth grinding and clenching problem themselves. So they're a little bit motivated to solve it as well. And, right now, after many, many, many trials and errors and trying to find the right form factor, the right product, we finally came up with SOVN, and we're now launching the beta units. As you can see right now, I have it in front of me. So the beta version still has this neck band, which is super light, super comfortable, super flexible. I've tried sleeping with it for a couple of weeks, and I don't notice it at all. It doesn't get tangled in my hair. And as you can see, I actually have a pretty long hair. It doesn't get tangled there. And these pair of earbuds just go in your ear. And I don't know if I can show you, but it's really, really tiny. So most of the earbuds that you've seen in the market now are not designed for sleep. They try to optimize the sound audio experience. So tends to be bulky, have microphones and Bluetooth that sticks out so that it can capture your voice really well. So your experience with current earbuds in the market wouldn't really represent how we've designed these earbuds. We've actually designed this from the grounds up to make sure that it's super comfortable, super tiny, super low profile, and comfortable to sleep in. And basically, there's a sensor here that moves whenever the tip is moved. So the whole technology relies on the fact that when you move your jaw, your ear canal moves as well because the two are anatomically next to each other. And you can test this by just, sticking your finger and moving your jaw a little bit, and you can feel that your ear canal moves. So based on that principle, we've designed earbuds with a sensor at the tip, um, so that whenever you move your jaw, the tip essentially moves, and those are picked up by the receiver in the earbud. And then based on the pattern of movement, we can then tell what is speaking, yawning, coughing, uh, or what is actually grinding and clenching, because they look very, very different. And you don't really make these type of quote unquote abnormal jaw movement that often during the night. And that's how we're able to pick it up. And um, what else should I talk about? Yeah. Oh, so how does it work? So now, once the sensor picks up the jaw movement and able to identify what is grinding and clenching and what is not, whenever it says, oh, yeah, this is grinding or clenching, it emits a very soft vibration like sound that you don't even perceive. I mean, you will perceive it, but it won't wake you up. And what it does is that it competes with the same neural resources as the one responsible for the grinding or clenching. So it's a sensory distraction technique where the sensory stimulus um, forces your brain to pay attention to it. And as a result, because our brain is not very good at multitasking, it stops the grinding and clenching. And then these information, so it shortens the duration at which you're clenching or you're grinding. And then the data then gets transmitted into the app. And on the app, you can see how much you're grinding or clenching every night, how long you do it for. And you can track your progress over time if it's improving. And also, this is where that correlation or tracking the different factors in order to try to correlate what essentially triggers your grinding or your clenching. So I'm going to stop there for a second and then see if we actually have any question from people. I know there are some people who had submitted their questions, so maybe we should go to that. Yeah. Okay. I see one from someone who had submitted a question to the first post. It says, the person asked, there have been other biofeedback devices in the past. What makes this different? Really good question. And to nitpick a little, I actually don't think this device or other bruxism devices in the past should be called a biofeedback, because traditionally biofeedback implies that there is a conscious involvement from the user to control their physiological activity. And in the case of using a device to intervene with sleep bruxism, all of the effect is happening subconsciously, and the user doesn't require any conscious participation from the user whatsoever. Like what I was saying before, the sensory stimulus forces the brain to pay attention to it, and as a result, it stops the grinding and clenching. All of this is happening without the user actively saying, I need to stop the grinding and the clenching. So this is all happening automatically. What I found most surprising when I dug into all the research on the past bruxism devices is actually how consistent the data are, even though they all use different detection method and intervention method. It's surprising how consistent they are. Basically, it reduces the frequency of grinding and clenching by about 20 to 90%, and it reduces grinding grinding clenching duration by about 50%. And we actually replicated this as well in our small proof of concept. So it's kind of impressive for it to have such a consistent result. But to to this person's question, how are we different? I would say three things that are very different between what we do and previous biofeedback devices. So the first one is comfort, second one is ease of use, and third one is the data. So we've spent a ton of time researching different form factors, not just in the ear, but also like all over the face, the neck, the body, to try to find what would be the most comfortable for people. That's not intrusive. The idea being, we want you to look forward to going to bed with solvent instead of dreading it. That you feel this is something that will help you sleep better and you don't have to wake up feeling worried in the morning. So the comfort is number one thing, and that's why we actually came up with this idea of an earbuds form factor, because in our test this was actually the least intrusive and most comfortable, interestingly enough, versus a patch or a band, a neck band that often comes off, or something that you have to lay on your face that would stick out. And then secondly, we've also designed it so that it's really easy to use. The only thing you have to do is, wear it when you go to sleep, and don't forget to charge it when you wake up in the morning. There is no calibration that you have to do. There's no maintenance. There is no cleaning. I laugh when I say the word cleaning, because that was one of my least favorite part about mouthguard, figuring out how to clean it, store it, and everything like that. So very easy to use. And last and not least, we want to make bruxism more visible through the data, because right now we basically rely on the subjective opinion of how much did you grind, how long did you grind last night. But once you start using the device, then you start having an objective data of what happened the night before and how does it change from day to day, because your episodes vary a lot from night to night, and a lot of people don't realize that, and they thought, oh, I'm grinding a lot every single night, and that sort of like stress you out even more, which is not helpful for your sleep quality or for your bruxism in general or your health. And so having that data served back to you is helpful. And then secondly, we're going to build an insights feature where you can track these different factors that are known to affect bruxism and see if they correlate to your bruxism level. So you can better understand what or certain behavior that you might want to modify in order to further decrease your bruxism behavior. So those are the biggest difference between what we do and the previous devices: comfort, ease of use or convenience, and the data or insights that you get from the device. There is another question that was submitted via email, actually. How will the app help me find my triggers? Yeah, so when we talked just now about when you use Solvent, you get your data, you get a measurement of how often, how long you clench or grind each night. And the app then takes it one step further by helping you to track factors that can affect your grinding or clenching behavior and then correlate them to your own data. So in the initial version, we will start with top factors that have been shown in clinical studies or scientific papers as factors that affect bruxism. So things like your sleep quality, do you have breathing problems during sleep, consumption of neurostimulants, certain medications, your stress levels. So every night before you go to bed, you can quickly log in the app and enter, say your caffeine or alcohol intake, your stress and anxiety levels, whether you're having allergy right now, so your nose is blocked, so you can't breathe properly from your nose. You can choose which factors you want to track or not. And then over time, the app will aggregate and analyze these data points and determine if any of these factors are significantly affecting or impacting your clenching behavior. And then in the future, we also plan to add a feature where you can add your own factor. So let's just say you think magnesium could help you clench less, just as an example. You can then create a personal tag to start tracking whether or not you're taking your magnesium pill every night. And then you can see, basically create your own personal trial and see whether that actually helps your process behavior. And we're also thinking of creating sort of a community-based research group that you can join. And we hope that this will help us gain a better understanding of bruxism. Yeah. Um, Let me see if there are any other questions. So someone asked, what about the beta test? Okay, yeah. So I've been a medical device executive my whole life. I've led different groups create medical devices for all sorts of complex diseases. And one thing I learned from my experience there is that what makes a great product is iteration, being able to launch quickly, get feedback from users, and improve it. Because you never design products perfect the first time around. Product gets better as users use it and provide feedback. And so that's sort of our philosophy with Solvent. And the reason why we wanted to start this beta with 200 units is because we want to get out there as quickly as possible, get feedback from people, and use that feedback to iterate the product. So um, we've basically put up a link for people to buy the first 200 units, and it was sold out back in November. Incredible support from the community, which we truly, truly appreciate. And so these 200 people will be essentially the first 200 people in the world to experience Solvent firsthand. And we have, we've started taking orders for it. So if you are one of the 200 who have put down a deposit, don't forget to complete the payment because by February 24th or end of this month, we have to basically decide how many we want to build and move forward with that. So, and for those of you who unfortunately didn't get the chance to reserve the first 200, don't be disheartened. Email us and let you know that you want to be on the waiting list, because if anyone decides to drop out from the beta list, we will definitely start going down the waiting list and let you get one of the first 200 solvent out there. So, yep, that's the plan. And what is part of the beta test? I think I didn't mention that. So, very simple. You will get the device and the app. We expect you to wear it daily and give as much or as little feedback as possible. And as part of the beta test, of course, we give you preferential discount, heavily discounted pricing, free lifetime access to the app, as well as prioritize customer and technical support. So if you have any issue, our technical team will jump, make sure you're first in line and solve all your problems. And by participating in the beta test, you also consent to us collecting your anonymized sensor data so that we can complete so that we can continue to improve the product. Yeah. So, is there any last question? question. And if you need more information about the beta, still considering whether you would like to be on a wait list, email us. We'd be very happy to answer your questions. Okay. Checking. I think that's it. Okay. Well, short and sweet. We'll stick around in case there are any other questions that come up through Reddit. But we're here and we'll be happy to answer any questions. Bye.